Hey guys, Dr. Jesse Cease here with Health Fit Chiropractic and Sports Recovery in Boca. Today we're going to talk about our triathlete patients. We see a ton of them here in our Boca Raton community. And one of the most common conditions that we see with our triathletes is hip pain or hip discomfort. And it can come in all different shapes and sizes. Today we're going to go over particularly active release treatment, ART or soft tissue treatment for the hip. This is how we approach the muscular work or the soft tissue work when we deal with our triathletes with hip issues. So some of the most common sites of impingement can be the hip flexor, the gluteus medius, which is the muscle kind of on the near the back pocket area on the hip. We could deal with a little bit of proximal IT band or TFL issues, and also hip external rotator. So we'll kind of run through a couple of those moves here, and we'll get started with glute medius. So glute medius is a big muscle that's responsible for keeping your pelvis in a straight up and down position. Or I'm sorry, straight forward and back position, and it's supposed to stop you from swaying laterally side to side. So if you're a runner, which if you're a triathlete you are, we want to make sure you're nice and strong in that forward-backward plane and not so weak in stabilizing when it comes to swaying from side to side. So if you have any weakness in that area or that muscle in particular, it can lead to issues and trigger point buildup or things like that. So treatment just looks like this. We'll have the patient abduct their leg. I'm going to get a nice, comfortable but firm contact right on that back pocket. I know you can't see it here. Patient's going to extend their leg. Go ahead. And drop it down towards the floor. Now this is Lizzie. Lizzie's our chiropractic preceptor. We'll do that a couple times. She is not a triathlete, but she's a pretty badass CrossFitter. So she's going to pretend she's a triathlete today. Good. And good. So again, nice flat contact, and we're just working with the muscle. That's a great stretch for that gluteus medius, those lateral stabilizers. The next one we'll talk about is the hip flexor. This is everyone's favorite muscle, right? So anything that revolves around the hip, everyone walks in, oh, I got a hip flexor issue. Half the times it's not the hip flexor. But the hip flexor is a very involved muscle in a lot of conditions, low back conditions, hip conditions. And it's very unique in the sense that it originates from the front of the lumbar spine. So if you have a very tight hip flexor, it's going to pull the spine and the hips close together, causing an arching sensation in the back of the spine here in the low back, okay? So in order to stretch this muscle, it's quite intense actually. What we're going to do is I'm going to contact, again, it originates from the front of the lumbar spine. So what we'll have the patient do is we'll have them bring their knee up. Voice cracking here. I'm going to get nice and good into this hip flexor. I'll have the patient just try to relax here. I know it's tough when I'm digging into their belly. Good. Pretty soft but firm contact here. It's not comfortable, but not super uncomfortable, right, Lizzie? Good. Good. And I'm just going to have you push into my hand here. Good. So I can feel that the flexion of the hip helps me feel that hip flexor underneath my hand. I'll get a little bit of tension, and you're going to go ahead and wrap that leg around my back there. Good. Good. She should feel a nice tug right underneath my hand there. Good. Come on back. Good. Awesome. And then anytime we do ART treatment, we usually look for 5 to 7 passes. We'll really start to feel that tissue release. That's why it's called active release techniques, right? Good. That's a great, great stretch for the hip flexor. Very effective. It can free up a lot of things from low back pain to hip pain. And the last one we're going to talk about is the piriformis muscle. Okay, this is a big external rotator. Its job is to externally rotate the hip, right? So we want to make sure that this is a common site of pain when we have patients or CrossFit or triathletes who do a lot of desk work in their downtime, or maybe they're busy with their work schedule. So don't mind me. I'm going to come around this way and try to give you a good depiction of what this stretch looks like. So we'll have the patient on their side the whole time. I'm going to contact right over that hip joint. So that big ball on your hip here, right on the seam of your pants, that's called your greater trochanter. The piriformis attaches right to the back side of that. I'm going to contact right in there. We're going to bring this hip forward, or knee forward, I'm sorry. Let the foot drop for the floor, and we're going to go ahead and bring this into full stretch until we see a nice wince in Lizzie's face there. It's a very deep stretch, very effective stretch. Again, the hip and the low back are so tied together with the biomechanics. So a lot of this treatment that we do for the hip in our triathletes is the same treatment we do for our patients who present with back pain. So it's very similar. But active release is very good for the athletic population because it's very good at treating muscular adhesions, right? So that's why we tend to utilize that specific technique when it comes to treating our active populations. We also realize that a big factor in our triathletes is the ability to be active on your downtime, but also a lot of you guys hold 9-to-5s that require you to be at a desk for a long period of time, or just be sedentary in nature, and that can really impact your performance if you're not careful. So what we're going to do in our next video is we're going to give you some tools that you can take with you to the office to kind of help keep everything limber. Nice, simple, and easy tools with minimal equipment that you can do right in your office, whether it be at home or back in the office, whatever your situation may be. So thanks for following along. We'll see you next week.